I am obliged, grateful that you have given me the opportunity to talk on this platform over this critical issue, which is hard to talk over here.
And my greetings for development of a new application. This is all over. Everybody is appreciating your contribution. So thank you very much.
Thank
Hina,
you.
over to you.
Thank you so much, sir. Bismillahirrahmanirrahim. It's my pleasure to welcome all of you in the virtual webinar series, which we organize regularly at the platform of Comstech. Today, as we all know, that all the beautiful souls, beautiful women out there are celebrating International Women's Day, and with the theme of Choose to Challenge for 2021. At the Comstech level, Comstech also played its role in creating and giving opportunities to the women scientists and scholars across the OIC region in order to strengthen their academic and research capabilities by giving lots of fellowship, training program, lectures, workshop, and etc., and many more other activities. Today we have came up with another very amazing speaker who will speak on a very important topic, and I request Coordinator General and my teacher, Coordinator General Comstech, and my teacher, Professor Dr. Mohammad Iqbal Chaudhary, for the opening remarks.
Thank you very much. As you said that we have someone of the stature of Dr. Zubaida Qazi, who is not only a very competent healthcare professional, but also a social activist. She has been working in this field. And I think for her lecture, nothing could have been better day than today, which is International Women's Day. And is extremely important that we all understand the opportunities and threats which are faced by women all over the world. Of course, opportunities are the one which we need to leverage and make sure that we give them opportunities so they can contribute immensely in the socio-economic development of the world. And these bold, bright, and beautiful girls of humanity, we are so extremely fortunate to have them because they are the one who can change the fate of the human race. At the same time, there are so many problems which they face socially, physically, medically, and among those problems, of course, this breast cancer is one major danger. This is a major challenge for the biomedical research, pharmaceutical research, and also apart from therapeutic intervention, prevention is also a major challenge. And this is the reason why this lecture is so important in the context of today, and why it is so pertinent to highlight this issue again and again. And we have someone who has been working in this field since long, who has sensitized people at different levels, who work with the society, healthcare professionals, and common people to seek their support and solicit the intention of the government at all levels to make sure that this issue is highlighted at the highest level and it receives the attention it deserves. With this, I would like to welcome Dr. Zubaida Qazi for this Comstech Distinguished Speakers Forum, and I appreciate her efforts.
Thank you so much, all of you, for inviting me, and congratulations to Comstech for doing such a commendable job and putting up people on a platform talking about issues which generally people don't know about. So it is a matter of great pleasure and indeed an honor for me to address today's August gathering. And I'm particularly thankful and grateful to the Coordinator General, Dr. Iqbal Chaudhary. Thank you so much, and Hina, for putting up this job.
Dr. Hina, I wish to introduce you to the audience because we have house full. I'm sure that many people are joining us, so it's important to introduce you to people from different countries.
Yeah. Thank you so much, sir and Dr. Zubaida. It's my privilege and honor to introduce formally Dr. Zubaida Qazi, a dedicated doctor by profession and a philanthropist at heart. Dr. Qazi is endowed with a strong passion to serve humanity, in particular the women of her country, Pakistan. She is the founder of Pink Pakistan Trust, which has been striving to improve the health and well-being of Pakistani women by fighting the ailment of breast cancer. Dr. Qazi has tirelessly worked to improve the infrastructure of public health system by devising a referral mechanism and ensuring the provision of much needed counseling services to the breast cancer patient in Pakistan. To break the taboos around the breast cancer in Pakistani society, Dr. Qazi has established breast cancer awareness centers in public and private sector universities, including University of Karachi, Qaid-e-Azam University, Islamabad, Government College University, Lahore, Shaheed Benazir Women University, Peshawar, University of Lahore, and Superior University. She's also launching a mobile application in local languages that will assist women to do self-screening for breast cancer, as well as provide free of cost consultation with national and international specialist doctor and psychiatrists. Extending her endeavors beyond the borders, Dr. Qazi has forged an international alliance with comstech-oic to create the awareness about breast cancer in the Islamic countries. She has also collaborated with ICCBS, University of Karachi, to support and fund breast cancer research in the country. She is committed to mobilizing the community and taking all the stakeholders on board to provide holistic support for well-being and welfare of Pakistani women. With this, I request Dr. Qazi to start her conversation. Over to you, Dr. Saiba.
Thank you so much, Hina. So nice of you for these kind words. As Hina told you and introduced me, so I'm a practicing radiologist, and I've been working in a public sector hospital where every day I came across with women who are suffering and roaming around for help. They don't basically know where to go and how to seek help because of the dilapidated state of health sector here. So we found it crucial not only individually to take part in for this issue. So where the population of Pakistan, which is comprised of 50% of population is women. So however, due to various social cultural issues, there's a huge disparity exists in the provision of healthcare facilities to this half population of the Pakistan. And that prompted us to emphasize over working over this such sensitive and critical issue. Before I proceed with my presentation, I would like to show you a small video, and then we can start with our presentation.
बैठे मैं कर रही हूँ ना वाह चलें बैठे हेलो हाँ हाँ ठीक है अब्बा जाइए सो जाइए कहाँ चले गए थे आप? मैं कब से आपको फोन कर रही हूँ। क्या है ये?
ब्रेस्ट कैंसर एक खतरनाक बीमारी है जो हर साल हज़ारों जानें ले लेती है, लेकिन बरवक्त तशख़ीस से इसका मुकम्मल इलाज मुमकिन है और हम इन कीमती जानों को बचा सकते हैं। ब्रेस्ट कैंसर से बचाव और इलाज के लिए पिंक पाकिस्तान का साथ दीजिए। आप हमसे रब्ता कर सकते हैं हमारी वेबसाइट और सोशल मीडिया पर।
Okay, so this video has been made by our volunteer, Pink Pakistan Trust volunteer. They have made so many collaterals for this issue because it's a taboo. There are myths related to this breast cancer. People don't want to talk about it. It's so sensitive in our society. So we found it. That if we make the difference through these kind of small videos and promotional activities which can break the taboo and spread the awareness as well. So start off with our presentation. We'll tell you some little bit about breast cancer, what are the incidences and the statistics. Now we are looking nowadays, and why this technology integration of making mobile app idea came into being, and how does it work. So breast cancer is the most frequently diagnosed cancer nowadays amongst women, globally affecting. And when we talk about the statistics, we always quote the World Health Organization. World Health Organization tell us that how serious and critical this issue is becoming in South Asia, especially in Pakistan, in developing countries. The incidence and death rates related to breast cancer are increasing day by day. And although the incidence rate, when we see, it's almost same to the other part of the countries. But when we talk about death, it's the numbers are increasing in Pakistan. I am practicing in women imaging department and from years, and been seeing patient as the breast cancer has been taken a disease of old age women. But nowadays we see young girls having breast cancer, and the main problem is that they came to us when the disease is not completely treatable, because the only thing which can save from this disease is the early detection, and early detection is only possible when the women are aware of themselves, when they know the body and when they know what changes are going on into their bodies. Sorry, I'm having a little issue in uploading my presentation. Soon I'll be sharing with you. But for further delays, everybody is here, so I don't want to waste all of your time. So when we see the incidence, the population, which is around 200 million, half of the population is women, and around 37% of their half population is at in the age bracket of 40 plus, where as a woman it is itself a great risk. As you grow older, the risk of breast cancer increases. There are few things I would like to tell you, as I can see there are females as well over here. And it's equally important to aware not only female about this disease, but the men also, because we make a society with men and women both, and where females and males are dependent to each other. So it should be very important to know about the health issues of women and men as well, so that they can easily they can talk about it and they can get solution to this. So there are few risk factors that I would like to know. That the modifiable risk factors and non-modifiable, and non-modifiable is that we are, as a woman, every woman is at the risk of getting breast cancer. As your age increases, the risk of breast cancer increases. It runs in a family, in a sense that if mother and first degree relative have breast cancer, so the daughter and the get the chance of getting this disease increases. Then women who get married, after 35 of age, and most of it, she gets pregnant after 35 of age, the risk of getting breast cancer increases. There are certain genetic mutation issues related to this breast cancer, which are BRCA1, BRCA2 genes, but this is something that we also need to work here for that. We can always, ask on our HEJ, the research, one of the biggest research department in Pakistan, that we should work on this genetic mutation thing, and what kind of genes we have in our population, which we never know it is there, and why. Then maybe this is one of the reasons that the risk of breast cancer is the incidence of breast cancer is more in our part of society, and why it is coming in early age. So this genetic mutation is one of the thing, and not feeding the babies, taking the the pills, the birth control pills, or after menopause for the long time, if you're taking steroid and some other hormonal drugs that also contribute to increase the risk of breast cancer. But there are some modifiable factors like lifestyle, exercising, taking care of your diet, because obesity is one of the factors which contribute to this disease, and be healthy is one of the very important things. As we earlier discussed with Dr. Iqbal Chaudhary as well, that there are few things that are in our diet today are the dyes, the colors, the preservatives, the food, non-organic food. These all can be the contributor of this disease. So we have to work upon this disease. We have the statistics related to WHO that in our population, as I told you, the 50% of population is women, where 35% is in the age bracket where risk factors increase. So the potential affectees we have, you can see it's the huge number, which every year affected by the breast cancer. So this is crucial that we should save these thousands of lives which are going towards death every year. Next slide. Back. Okay. So there are a few things that what we did because of the COVID, we have not been able. We are not being able to one-on-one with the society and with the people. So despite of COVID, we have conducted more than 30 workshops, and where we examined more than 3,000 patients clinically, and aware them that what is this disease and how you can deal with this disease disease, and what are the steps that you should be taken in case of those signs and symptoms. You should consult the doctor, and how to break the taboo and how to break the inhibition. One should talk about the disease always. Don't take it that, one of a very sad thing in our society, that the women doesn't want to talk about this disease because there are social cultural issues associated with that they got divorced, their personal families got distorted, the children will isolate them. And then along with this disease burden, the women suffer also with the economic issues as well, because the treatment is very expensive. The diagnosis process is not available everywhere. The health facilities, because it's not available everywhere. So what we did is that we made a whole portal of doctor, the whole referral mechanism, where we can send the patient with the free diagnosis, and treatment can be done. So this is one of the way. As Hina told you already, that we have signed MOUs with different institutions along with comstech and HEGAJ as well, where we find so many volunteers, which are the word of mouth, not only the word of mouth for us to the people, but they are working for us and for different activities we are doing as well, other than this health issues. Then we are working on, we have made the breast cancer awareness centers in Karachi in 5 different areas, where we are not only awareing the people, we are giving them the whole referral mechanism so that they can take help out of it. Medical centers, and along with that, we are also extending our expertise with other organizations like Charo for Compassion and Ahuat, who are already working for the welfare of the country. We are also extending our medical expertise to them, and we have conducted fortnightly our sessions, our examination session, screening session, and sending the patient, whoever needed, to the doctor. Now we are working with the health department so that we can rehabilitate and we can rebuild those dilapidated units of the government which are there, but they are not in the working conditions, so that we can re-strengthen them to reduce the burden of tertiary care hospitals. Because I myself, working in a tertiary care hospital, can see that because of non-functioning DHUs, everyone has to come to the big hospitals, whether they live in slums, it is in interior Sindh, people have to come here all the way. So it's very important to develop those centers so that for for their minor issues, they don't have to travel a lot and not taking so many pain for this. This is very important because this thing not only burdened the tertiary care center, it is also decreasing the quality of the treatment as well. So we are building the mechanism of systematic approach towards the patient as well. Other than the healthcare, we're also working on the vocational training program for the females of our society, because working with the breast cancer, we came across with the patients who, as I told you, get separated from their families, being isolated, their economic burden and increase. So we also provide them opportunity to be economically independent by providing them entrepreneurial training and setting up small businesses as well, so that they can take care of themselves and their kids as well. So these are the few initiatives and targeted we have achieved. Now, coming back to the mobile app, that why we have developed this app, and since COVID, we found that people are everything has become online. So mobile is something which is and internet is very much accessible to the people. And according to the research, around more than 7.5 crore of our population is using mobiles, and 70% of them are using Android. So this mobile app is first we launch it on the Android, and then the second version will be soon come on the Apple Store as well. The the need of this mobile, why we establish it, is that although we are doing so many awareness sessions and seminars and centers has been developed, but I think that this is not sufficient. It is not sufficient to cater the such a huge number of population. So mobile in different languages, multiple languages, not only in English and Urdu, but in Sindhi, Balochi, Punjabi, and Pashto, which is our regional language. It made accessible to every woman who is not aware of English and Urdu, and women who is shy, who doesn't want to talk about her issues, can easily go through this mobile. She don't have to talk to anyone else rather than having everything in this app. This app, it took a while to us to build it up, and there's so many complexities going through in between, and you would be delighted to know that this is all volunteer work done by my IT people, and there's so many hard work related to that. Although it looks so easy, but it's not that. It's been, brainstorming like a while for doing this app. But I'm very happy that when we launched it today on such a special occasion of Women's Day, and I'm talking to you about this, we found a very good response from this, and inshallah we'll find it beneficial for our women out there in other region as well. I'll go through you quickly through this app. So this is one of the technology integration we did to the to this breast cancer health issue, and I found it very suitable in terms that it is very easy to use in terms of language as well. And once you download this app, you don't need any internet connectivity. It can be done without any internet connection. It will tell all about the breast cancer, what is breast cancer, what are the risk factors, how you can examine yourself. Next. Yeah, so self-examination, I would like to tell all of you, the females out there, is one of the best simple screening tool that is very important to detect this disease early. Although this is not the scientific screening tool, I mean, in terms of technicalities, only the mammography or ultrasound is the best screening tool. But where in our low socioeconomic setup of country, where mammography and sonography is not available readily to the women, and people don't know that after 40 years of age, internationally in Europe and USA, this is the state-of-art facility available to all of the women over there, that they go and screen themselves every 2 years, and after 45 of age every year, so that the breast cancer can be detected early. But for our setup, where we are unfortunate that we don't have it, and inshallah we'll try to make it and build up this kind of setup that where we can provide women with mammography and ultrasound. Till that, everyone should know that how to self-examine herself, so that she will know her normal anatomy. And once you know what's normal with you, you can easily detect the abnormalities. So in this app, we have incorporated the animations, so that it will be easy for the women who wants to check herself. She can just go through it, and with the videos, she can examine herself in 5 minutes time. Once a month, every woman should examine herself. The best time is 1 week after the cessation of her menstrual cycle, and after menopause, any day of the month can be selected, like 1st or the 30 or 31st of the day of the month, so that she will be aware of her changes. There are few changes which I would like to quickly go through here, that the size and shape, the color, the size and shape of the nipple, any abnormal discharge from the nipple, any dimpling or puckering of the skin of the breast, and underarms as well. So these areas should be checking carefully, and then palpate for any kind of lump you can feel in your breast and or in your underarms. It's not a complicated process, and with the provision of this visual aid along, it made everyone very simple and accessible to do her self-examination. And after examining, it doesn't end over here, that you just examine yourself and then it gives you a report at the end of the examination. You say yes or no after every examination, and in case of few symptoms, if the report has generated that now you need a doctor, an appointment or consultation, there is the option of consultation over there with doctor or with therapist or with survivor as well. Doctor's appointment can be online, or if someone want to go and check her face to face, she can do that. Therapist is very important. This is one of the links that we found missing in our healthcare setups, which is the counseling, which is very important. And as we all roam around in the world, we found it crucial part of the health sector. Because when anyone is going through any kind of disease, with physical trauma, there is a mental trauma as well, and it has to be catered properly. It's very important. For that, a trained therapist is a solution. So we incorporate. We have the whole volunteer team of therapists with us, which give them free of cost counseling. Because during breast cancer, I personally see every day people coming to me with physical, more than this physical trauma, they have got mental stress, the family pressure, the pressure of, being just the surgery has to be done, the breast has to be removed, and there's a long chemotherapy procedure, and then she will lose her hair, she will have multiple changes in her body, nausea, weight loss, all these things are going on simultaneously, and she needs a good support with the family, with the doctor, with the therapist. So we counsel not only the patient, but also the whole family, so that they will give her the boost, and she will be getting help to go towards a healthy state. So it's a long procedure, and all through this procedure, she needs the support. For that, counseling is there. And survivors are the best counselors. That's why we put the survivors here, because they, the way they, share their stories and motivate the patient, that's remarkable, that's commendable. After that, we have got a discussion forum here, so where anyone wants to discuss their issues, their problems related to breast cancer. They can talk to experts, they can talk to peers, they can talk to survivor, and there's a time there where one can answer them on the portal. One of the very important thing while we're making this app was the thing that how the patient data secrecy will be should be there. So the privacy has maintained through this app by everyone cannot use it without login to this app while going to discussion or consulting a doctor. And the whole privacy system has been put up there, so the data cannot be leaked or shared with anyone. The other thing is that the second version is under the process, so we need as much feedback from this app we will get, and then we will. From this forum, I also request you all that you please download this app. This is Ping Pakistan. You dial it on Google and download it and send us your feedback so that we can improve upon it, that what else we should be doing with this. Can you go back? I'm just checking it so that I will not be missing up anything. Information step by step and on examination and everything we are covered up. Okay, next. So this is one of the technology integration that we did with multiple language, and I hope people will take advantage of it. The next thing that I would like to talk about is that we are also working on cancer registry with the Sindh government. Why it is important to have data, as all of you scientists over here know that very well, and I don't have to elaborate upon it. But unfortunately, we in our country don't have any national registry system available for that. We have, every time we have to bang upon WHO data. So when it comes to research or when it comes to talk to international world about anything, you should have your demography with you. For that, data is very, very important. So we have made a prototype for this data registry system, and we are sharing this with the Sindh government, as Punjab has already have this kind of cancer registry. They're working very well. This is very unfortunate that we all have all our hospitals, big hospitals, either public or private hospital. They all have their data available, but we don't have a single platform where we gather it and we are not ready to share the data with each other. There's so many constraints, I know, I can very well understand, but this is very important that we should set up and make a platform. So cancer registry is one of the very important thing which we are working, and I'm sure the other people are also working, and with the help of Dr. Iqbal Chaudhary, we are inshallah soon meeting up with other people and can make a better plan for that. So data collection and storage has the whole system and how to disseminate it, and the very important thing is the privacy of the data. And then the analysis part came, where kind of HED and comstech big institution can always help us with this, that how to analyze this. And then we can, once we have our demography, we can always go for good research, which is very, very important for us and need of the time for this breast cancer, that we should know that what are the genetic mutations, what are the additional risk factors we probably don't know why the incidence and death rate are increasing. Incidence rate, I might say, depend upon the risk factor, but death rate for sure, the one of the biggest reason is the taboo, is women are inhibited, they don't want to talk about it, and most of the women are not aware. And who are aware, whoever are aware even, most of them don't have the health facility available. Because of that, the delay will occur in the disease, and cancer is one of the diseases that give you very small window period where you have to go to the doctor. Otherwise, once it's disseminated, you cannot do anything about it. But the good thing about the breast cancer is that we have the whole treatment available in Pakistan, a very good treatment available in Pakistan, not only in private sector, but public sector as well. We have the whole forum of doctors available with us, with surgery, chemotherapy, radiotherapy, everything available. It's just that we have to channelize ourselves and send and refer the patient as soon as it has been detected. So this is one of the important things. We are working on it. Database nomenclature is, I've told you the same thing, that demography is important. And after not only the demography, we should also know about the type of the disease, what are the nature of the disease, what's its characteristics, and the different stages of the disease on which we have to work. And there are so many new treatments are evolving every day, especially the chemotherapy. Since chemotherapy has been evolved, the disease is completely curable and treatable. Before that, we cannot say that it's treatable completely, because one of the things I would like to share with you, we have a mindset that people thought that once the surgery is done, there's no need of chemotherapy, no need of radiotherapy. This is a very general mindset of people. I'm telling you, it doesn't depend upon how educated the patient is or not. They all just somehow they don't want to go through this process of chemotherapy. So it's very important. Either we tell them the whole scenario, but it's very important to know them that surgery, chemo, radio, and post-surgery follow-up. This is the whole package of the treatment, and this without if you skip any one of this step, the disease can disseminate again. So we have to reinforce this thing within our population as well. In the end, I would like to share you as a few of our collaborating partners who are working with us, because as an NGO, it's not possible to work alone. So there's so many good people who would like to work with us. Are few over here. So universities are with us, and now we are going to build up our basic health care units, not only providing the basic healthcare units, but also making them the breast screening and referral place for the treatment to the patient, especially to the community who is marginalized, who cannot afford the treatment. And we also have one more thing is adopt a patient scheme. Why is that so? Because there's so many people who want to do something for the good, but they don't know how to do that. So that we want them to just adopt any patient, one to any number of patients they can cater, and they are directed to the hospital where they can easily pay off their expenses, and the patient can be treated over there, so that the finances is well taken care by the person who is giving it. So this is all about my presentation, and thank you so much, all of you, to hearing me and letting me talk about this very important issue. Hina, over to you.
Thank you so much, Dr. Sabra, for such an excellent and informative.
I'm so sorry, Hina, for the interruption in between. My system wasn't working well, so
that's perfectly fine. That's no problem. Technology has certain limitation also. So thank you so much for a wonderful discussion, come talk, and congratulations for launching this app on a very right day also. With this, I think floor is open for question and answer, and we have some questions in chat box as well. I can read them for you. दिखाइए कैल्शियम चार्ट जरा ऊपर करें. Okay, doctor, is there any particular reason specifically for the rise in breast cancer cases in Pakistan?
Yeah, Hina, as I told you earlier, that's what we are working on, and we would like to do this research in collaboration with, one of the leading research institute of Pakistan, which you guys are working very well. Okay, why the incidence is increasing? Although we know that the risk factors are already there, but what is the alarming thing for us is this: we are seeing young patients having breast cancer. And for this, it is very important to know that what is this thing. So it could be something else which we don't know, which is the genetic mutation probably, which is present in the Western world, but maybe something new which is present here. So we should work in our setup for this. But for most reason is that people are ignorant. and people don't have the facilities available where we can go and check themselves at the early stage. We don't have these kind of basic healthcare small units everywhere, and throughout Pakistan, where this message has to be given, that how to examine yourself and what to notice while you're examining yourself. As I told you, this is one of the simplest and cheapest way of knowing breast cancer at early stage, although it is not the scientific one. But so one has to be aware of the body, one has to be aware of the changes, and one has to talk about it. I'm telling you, Hina, this is one of the biggest issues that people don't talk about it. Even I go to awareness session to the place where people are well educated, well aware, where they don't want to talk about this issue. So we have to break this, ice to know about yourself and go to the doctor in case of any sign and symptoms.
Right. Okay, Dr. Saba, we have another question in the chat box. What are the chances of breast cancer in married women and feeding mothers?
Married women, if as I told you, there's a risk factor when if someone get married at late ages, like after 30 or 35 years of age. But more of this, if someone gets her first baby at the age of 35 and after 35 is more have getting it's more at the risk of getting breast cancer. So feeding mothers are to be at some percentage at the safer side of it. If she doesn't have any family history, so we say that she is safe if she is feeding the baby. If some medical reason someone is not feeding, that can be accepted, but for other than any reason, one should not do that, because it's not only safe you, it's also good for your baby as well.
Right. We have another question. Is there any link between breast cancer and menstrual imbalance?
Menstrual. It's not directly linked menstrual imbalance, but yes, if early menarche and late menopause is one of the risk factor of getting breast cancer, but not directly related to with the imbalance of cycle. Yes, breast cancer is related to ovarian cancer because ovaries are something that produce hormones. Those hormones are responsible for breast cancer. So ovarian cancer can be directly related, but not the menstrual imbalance.
Right. Thank you, Dr. Saba. Is there any other question from the audience? There is one question from Ms. Nudra. There are vaccines available for breast cancer women with some age criteria. Are those safe?
There, I think there's no particular outcome came out of those vaccines, although they are, I think, probably now not even in a trial base, because there are not enough patients available, not enough women available to get these vaccines. Like COVID, women are hesitated to get these kind of vaccines. There are so many issues related to that. So I haven't have read anything about it. So it's safe or not. So probably.
Right. So we have a colleague at ICCBS, Dr. Ishtiyaq Ahmed. He wanted to know that we are working on breast cancer genomics. How we can collaborate with Sin Cancer Registry to engage patients.
Okay, wow. Ishtiyaq, I think, who is that? Ishtiyaq Ahmed. I think we can talk about it, and we can work together while we are working with this cancer registry. This cancer genomic is very, very important. We can share our working with each other, and we can definitely come up with something that we can talk on it. Hina, you can share my contact with him if he wants to, and we can work on it.
Okay, excellent, Dr. Saba. Thank you so much. And I am flooding with question on chat box.
Okay.
It is an excellent initiative to develop digital and mobile solution to reach out to the majority of women. Is there a way to collaborate with you in further enhancing these apps, like with computerized image processing and decision support system?
Most
Asya.
welcome. Most welcome. We are welcome to everyone who would like to work for the cause.
Right. And this is from my colleague Hazima. What should be the testing frequency for people with family history, girls under 35 and above 35?
Okay, that's a very good question, Fazima. After 40, it should be mandatory for every woman, rather having a family history or not, to have a screening mammogram. And after 50, screening mammogram once in a 2 year. But after 50, once in a year. And with the family history of breast cancer, if a mother has cancer at the age of 50, the daughter should start screening herself 10 years prior to that. It's that high risk. So, or if the elder daughter has got the cancer, the younger one should screen themselves. So the 10-year gap is, she has to screen herself prior to 10 years of mother or elder sister had that breast cancer. And sonography can be done safely because mammography has got some radiation. That's why we said that after 40 years, sonography can be done at any age because it's very safe. It doesn't have any radiation. So if it's early stage, someone is having any problem, any symptoms, or any history, so she can be screened with ultrasound until and unless advised by the doctor to get mammography done.
Right. Okay. Now, what is the reason why the rate of breast cancer is increasing in non-married young girls? I think you have already.
Yes, exactly. The hormonal imbalances and the other issues related to that.
Yeah. From Ikram Barni Sahab, we have if there is a mutation in BRCA or 2 gene, then MRI is more sensitive than mammogram. MRI should start at age of 30. I think more of a comment.
Mammogram done, yes, he's absolutely right. Mammogram in case of genetic mutation, mammogram helps a lot, but still, MRI helps a lot, but still mammography, since it's develops a lot, the 3D mammogram is very, very sensitive. It says that MRI it's more sensitive than MRI. So screening mammography always has upper edge than MRI, until unless it has some other related, options with that.
Right. And are there attitude or behavior to adopt to prevent breast cancer?
Yes, as I told you, the modifiable risk factors. Exercise should be part of your life. 45 minutes of exercise is very important. There are researches, there are papers on it, and it has been proved that how exercise helps a lot. Even yoga, and obesity is one of the risk factors, I told you, because as you grow older and you're obese, so you're fat. So your fat start producing hormones, those hormones which are responsible for breast cancer. So your diet and your weight check and balance is very important related to breast cancer.
Excellent, Dr. Saiba. Thank you so much. And I see there must be many more questions as well. But
I am delighted to hear all those questions. Hina, you can always give them my WhatsApp number if they want to. I'll be happy to answer them there as well.
Right. So with permission of Dr. Saiba, I'm announcing at this forum that if anyone is interested in either collaboration or some question, kindly do write myself or Ms. Khazima. So we will provide you the contact detail of Dr. Zubaida.
Yes, they can go to the website, they can contact us on social media, anywhere they want.
Yes. Thank you so much. With this, Dr. Saiba, once again, I would like to thank you for your precious time and such a wonderful, excellent, informative talk. I would like to thank all of the participants also for joining in, and I would like to thank Hazima also for all the coordination and arrangement. Thank
I'm
you so
really,
much.
really grateful. Thank you so much, Hina. Thank you, Dr. Saab. I'm really honored to be here, and it's really a great experience sharing with you.
Excellent. Thank you. Bye-bye. You all have a good day.
Allah Hafiz. Good day.